riding on the Emergency Solid Waste Management Program, guided by Statutory Instrument 140 of 2023, following the declaration of state of disaster in Harare Metropolitan Province, government has embarked on a number of initiatives from the water side, water reticulation side, infrastructure development, the financing of a number of initiatives, as well as the technical interventions in different sectors that affect Harare. So we have an Operation Chenesa Harare. And part of the interventions also include interventions from the Ministry of Health and Child Care under the leadership of Dr. Douglas Mombeshora. So Dr. Mombeshora, you can, I am now handing over to you so that you can disseminate the necessary issues related to Operation Chenesa Harare as we seek to ensure that we have got sustainable, clean cities through central government interventions, so that we can also be in a position to deal with the cholera challenges that we are currently having in Harare Metropolitan Province. But obviously this has been necessitated by the challenges, or by the failure or the deficit from the leadership from the city of Harare as a council which has failed to be in a position to provide the requisite water infrastructure, to be able to provide the requisite health services across Harare Metropolitan Province. So I'll allow the Minister of Health and Child Care to immediately outline the interventions that the central government is implementing for us to be able to have a clean sunshine city, a clean metropolitan province. Over to you, Dr. Mombesha.
What has been said, we are embarking on an operation which is codenamed Chenesa Harare, meaning Clean Harare. This operation has been necessitated by the increased cases of cholera that we are now witnessing in Harare. As you know, cholera is a deadly disease if not managed well. But the causes are easily preventable because it's due to poor hygiene and sanitation conditions. And part of this operation is to address the poor hygiene conditions which are now prevailing in the city of Harare. It is duty of government to intervene wherever they see things are not moving properly. Harare City Council is failing to collect garbage. Harare City Council is failing to provide clean potable water, and Harare City Council is failing to have a proper sewer reticulation system being operational. The first intervention has been necessitated at the level of removing solid waste. I'm sure all of you, if you travel, if you move around the city of Harare, you see piles and piles of garbage. People are just dumping garbage in undesignated areas, and this has not been collected. So government has mobilized resources from its own resources and also from the private sector. Private sector has come in to assist so that we clean up Harare. We have given ourselves 1 week, starting from the 5th, which is yesterday, up to the 12th, to make sure all garbage in Harare is collected. The Department of Civil Protection has managed to mobilize the following list of equipment which I have just outlined to you. We've got tipper trucks from City of Harare. We've got refuse compactors, total of 14. EMA has brought in 2. We've got private players who have brought in a total of 6. So tipper trucks we have 13, front end loaders we've got 6, backhoe loaders we have 1, and refuse compactors we have 16. These are already in Harare and they started operating yesterday. I'll just talk about the progress that has taken place so far. Yesterday, we managed to move just slightly above 65 tons of garbage using dump trucks. But the total tonnage that was moved with all other front-end loaders, compactors put together is slightly over 122 tons. And all this garbage is being taken to Pomona dump site. So we have arranged 5 regions, and I will just mention the regions so that you know how the deployment is taking place. We've got Region 1. Region 1 covers the areas and suburbs of the Central Business District, Mbare, Sunningdale, Waterfalls, and Hatfield. And we have got 8 trucks operating in that area. We also have Region 2, which covers Harare South. That is Hopley, South Lipak, Usheo Kunze, and Eyston. Then Region 3 covers Highfield, Southerton, Glenora, Glenview, Churufam, Budiriro, and Mfakose. This is quite a big area, and that's where we have seen quite a lot of cholera cases coming from. And that has been given a priority, and 14 trucks are operating in that area. Region 4 covers Dzivarasekwa, Warren Park, Kambuzuma, Kuadzana, Mebarain, Marlborough, and Mount Pleasant. And finally, Region 5 is Borodale, Heathcliff, Highlands, Greendale, Mabuku, and Tafara. So resources have been allocated to these areas. We are hoping that within the next 7 days, all the garbage will have been cleared. We are also moving on to the next stage where we want to provide clean water, clean potable water. And government is moving in to mobilize resources to procure water treatment chemicals, which will be supplied to the city of Harare so that they can provide more potable water. Currently, I'm informed that the supply of potable water has dropped from 350 megaliters per day to 200 megaliters per day. So it has to be improved. Otherwise, we won't be on top of the situation unless we also provide clean water. Provision of water is also important in terms of alleviating blockages of sewer systems. When you have solid waste not being flushed, it then compacts and blocks the sewer lines. Therefore, water provision will also help in alleviating sewer blockages. So this is where we are, and we will be updating you as we move on. I thank you.